Hello and welcome to Living Well with Robin Stoloff, empowering you to live a healthier life. Since the pandemic began, everything has changed, including how we work. But the benefits of staying healthy, productive, and positive are more important than ever. As the escalating price of health insurance continues to stress corporate and household budgets, employers are turning to wellness programs as a way to help bring them under control and improve the health of their team. Here with us now is Beryl Krinksy. She's a registered dietitian nutritionist and the founder of B.Komplete Corporate Wellness Program and Complete Business Dietetic Internship. Thank you so much for joining us.
Thank you, Robin. I'm very happy to be here today.
Well, I'm excited to have you because I love this whole concept, trying to help people in the work environment to improve their health. It makes such a difference. Tell us about Be Complete and what inspired you to launch this business back in 2014.
Absolutely. Be Complete is a full-service corporate wellness firm, and we take a really holistic approach to wellness. And we work hard to meet the populations and the individuals where they're at and help them in ways that are going to work for them. So everything's very customizable. I started Be Complete because I am so passionate about living a healthy lifestyle, and I wanted to share the knowledge of health with as many people as possible. And we do everything from nutrition and exercise and stress management and mental health and well-being and prevention. And we work with all different types of businesses and individuals. And one of the most rewarding things about Be Complete is when companies and individuals tell us that we didn't just, quote, help them lose weight, we helped make them happier.
That is really great to hear because it is all connected, our mental, our emotional health, and our physical health. Now, we all know things have changed since COVID-19. You were in 11 states before the pandemic really hit. Tell us how you've made the shift to online assistance for people.
Yes, back in 2019, we had expanded to help companies out in California and Texas and Florida. And then when COVID happened, everything was put on hold for about a month. And so we had about a month to pivot and transform as many of our in-person events to virtual. And so that meant we had already been doing some things, for example, webinars and online challenges and a little bit of virtual coaching. But now we offer a tremendous amount of diversity in our online and virtual wellness services. Some of the really popular events that we've been doing are virtual cooking classes. And that's really fun because the employees can cook along with us. And we've been doing something called virtual grocery store chats, which is also really fun and it's really useful. Employees in real time will show us these are the products that we have questions about and we can answer, which is very helpful. Talk about how to help people save money also. We've been doing a lot of stress reduction webinars and mental health and well-being webinars. And we're also partnering with a financial wellness firm to teach populations how to save money, how to plan for college, and all different ways to reduce stress through being smart with finances. And one of the services that we offer is one-on-one nutrition and wellness counseling. And when COVID started, the health insurance companies authorized telehealth. And so we've been providing telehealth nutrition and wellness services to individuals. And this is something that's included within many health insurance plans, which is a great benefit that individuals can leverage.
That really is one-on-one nutritional counseling right in the privacy of your own home. So people must really love that. What type of businesses do you work with?
We work with small to mid-sized businesses and all different types of industries. Some are advertising, engineering, technology firms. We work with some manufacturing companies. We work with some nonprofit organizations, medical organizations. So really a very diverse group of corporations that we work with.
Tell us about the response and what people are saying after they've been through your program.
That is That is the best part about what we do, because sometimes groups they don't know what to expect, or they might be a little bit hesitant and they think, oh, the employees might not respond well. And then we get responses from clients and individuals at the companies talking about how they tried, for example, a recipe that we demonstrated in a cooking event and their family loved it. Or we talked about and taught people how to practice mindful eating, and they started doing that with their family, and they all had such better meals and were making better food choices, and their mental health improved through that. We've taught people about ergonomic safety at your desk and at your dining room table, or wherever you're
Where
working
we're working
right now.
Yes.
Wherever you're working. And people have told us how these small shifts and learning how to sit and stand properly and stretches you can do at your desk has made their workday so much better and also much more efficient. We've helped people with planning. We've helped people with meal prep and planning, and there's been such a great response, and people have just said over and over, wow, I just didn't even know that making these small changes could help improve my life so much.
And actually, many people also say that it's not as hard as they thought it would be. Isn't that right?
That is right. A lot of times people say, I didn't ever want to try to eat healthy, or I never wanted to try to do exercise. But then we'll show them simple ways to do it that's not that different than what they're already doing. And that small shift, it makes all the difference.
Walk us through what you do with a company that has decided to sign up with your services. How does that actually work?
Sure. What we'll start out with is employee interest surveys, and this is all done online, regardless of COVID. It's all confidential. And we're going to poll the employee population to understand, what are your specific health and wellness concerns? And then what are you looking for? What are you interested in? And a little bit about their knowledge and their lifestyle. And I will work directly with the human resources department or person to really understand the culture of the company, and what are they expecting, and what are the objectives, and what are they looking for. So we develop a plan based around the employee interests and the corporate culture and the corporate interests. Depending on the population, we might do events every month. We could do events every quarter. They might sign up for the nutrition and wellness one-on-one counseling. We might do group events. So it really depends on the group. And then at the end of the year, depending on what the program was and depending on the number of participants, we can also provide reporting to talk about, these are the changes that occurred. This was the interest level. These were some of the health changes that occurred. And that's really rewarding too, when we can show year after year improvements with the health and also with reducing stress and providing prevention too.
It sounds like it is completely customizable, but how long in general is the program?
Well, let's see. We've worked with some companies for 5 years, and that's an ongoing relationship. Sometimes we'll do a one-off health fair, something like that. And it really, really is depending on the group, because as people get older, you need different types of health education. For example, younger populations, you might deal a little bit more with ergonomics and exercise and maybe wellness challenges. And then as employees start to get a little bit older, then you're going to focus more on disease prevention and understanding health numbers, and perhaps a little more about one-on-one counseling and coaching.
What are you hearing since COVID began? Are there different needs right now?
Yes, there are a couple requests that have come to the top are help with mental health and help with financial wellness.
Everybody needs all that right now. Mental health especially, or emotional health, I like to say, because
Yes.
it is such an important part of our lives. And so many people are struggling right now in so many different ways. So that is a key element in keeping people healthy, because we're not just the physical side of things, but we're also the emotional side. And we need to make sure that we take care of both, which is so important. So you also have another company called Complete Business Dietetic Internship. What is that about?
Yes, and that's something we're so excited about. To become a registered dietitian, you have to do, well, there are a couple of different steps, but one way is to do an accredited dietetic internship. And oh gosh, going back about 6 years, I had this idea. I was working with some dietetic interns, and I kept getting the same questions. They would ask me, how did you start your business? How did you, before B.Komplete, I had worked in the food industry. They said, how did you get into the food industry? And how do you do marketing and sales and all these questions? And I thought, and this is going back 6 years, I thought, wow, I should start a dietetic internship that teaches interns how to start a business, and they can start a private practice or become a consultant or get into media or whatever it is. And 6 years later, that's what we've created. And our dietetic internship, it's a distance program, meaning the interns don't have to move. For example, our class that starts in January, we have 3 interns in California. We have 1 in Georgia. We have 2 in northern Jersey, and the rest are in New York. And so they're spread across the country. And we provide a robust curriculum to teach them not only how to become a registered dietitian, but also how to start a business and all the steps that are involved that they don't usually teach you in school. And then the interns will do their rotations wherever they are living. So whether it's California or New York or New Jersey, etc.
That is one of the benefits of this virtual world. I've spoken with people who have made that pivot and shifted to virtual programs in whatever business they're in. And some of the benefits of it is that you can be and talk with people, be with them wherever they are. And that makes it really easy and convenient. People don't need to drive or relocate. So there are some positives. We're trying to look at the positives of all of this, what's going on right now. So that is great to know. So that's an interesting business as well. And if anyone's listening and would like to get involved with whether it's a business owner or an employee, how can they reach you?
Sure. They can visit our website, and the B.Komplete website is BKOMPLETE.com. And they can also email us. Our information email is info, it's INFO at BKOMPLETE.com.
And that is your initials, BK. So that's a good idea, the way that you put that together. You are a really amazing entrepreneur with a goal to help other people. And what could be better than that, Beryl? So we appreciate you joining us and sharing this really interesting business. If anyone is interested, we will have a link to Beryl's website in the show notes. Beryl Krinksy, registered dietitian nutritionist and the founder of B.Komplete Corporate Wellness Program. Thank you so much for being with us.
Thank you, Robin. It was such a pleasure.
I enjoyed it too. And thank you for joining us today for Living Well with Robin Stoloff, empowering you to live a healthier life. Be sure to subscribe to get updates on my most recent weekly episode, and let us know if you or someone you know would like to be a guest on the program. Just reach out to me on my website, livingwellwithrobinstoloff.com, and you can always find me on Facebook, Twitter, or Instagram. Until next time, please stay safe and keep living well.